Hi everyone, welcome to Chapter 9, Women's Health. Third time's a charm after a bunch of background noises like my heater kicking on and me stumbling over my words. We're going to try this one more time. So before we get into the discussion of women's health, I did want to point out that this is in no means meant to be discriminatory or biased in any way. Certainly there are certain conditions that affect men disproportionately over women. However, an analysis has identified that there are 19 specific conditions which disproportionately affect women over men. And these are specific to women, related to our higher life expectancy, or are simply a result of gender discrimination. So we are going to talk about the importance of women's health, and I'd like you to think about that. What is the burden of disease for women, especially when we focus on low and middle income countries? And then what are the consequences of women's health issues? So some of the important factors are that women do face a number of unique health problems. The poor health of women can have enormous consequences on society, predominantly because the health of children does depend on many ways on the health of their mothers. So key definitions, I'll let you read through these yourself. Some of the more disturbing, or I should say enlighteningly disturbing issues that we're going to talk about: female genital mutilation. This is a predominantly cultural practice. It is still almost universal in certain countries. It is related to the cutting of the female genital organs. Maternal death, I think this is a key term to focus on because it includes the death of a woman while pregnant, during delivery, or within 42 days of delivery. Sex-selective abortion is another term that can be rather disturbing, rather eye-opening. The practice of aborting a fetus after a determination that the fetus is the undesired sex. Typically, and in many countries, that would be a female. So some of the determinants of women's health. Certainly we have to consider biology and biological determinants in there. Iron deficiency anemia related to menstruation, complications of pregnancy, increased susceptibility to some STIs, and then health conditions such as ovarian cancer that are specific to women for biological reasons. Social determinants of women's health. We've got male preference in some societies, and that is sometimes manifested through the sex selection abortion. Young female children are often fed less nutritious food than the male children in many cultures and ethnic groups. Low social status linked to physical and sexual abuse and also depression. Household roles can lead women to cooking with poor ventilation indoors associated with respiratory disease. And then poverty, lack or low levels of education, and low social status limit access to health care. So again, touching on the health disparities. Some of the burden of health conditions for females, as we mentioned, sex-selective abortion. So there is a skewed ratio of males to females in some countries. The two countries predominantly in which this occurs are India and China. And as you can see, India has 112 males born for every 100 females. China is very close to that with 111 males born for every 100 females. Unfortunately, rising incomes and levels of education have actually led to an increased incidence of sex-selective abortion in these countries. When we talk about STIs and women being biologically more susceptible to certain types of STIs, risk factors do include women at a young age engaging in sex with high-risk partners, inability to use a condom based on cultural and religious beliefs. What this has resulted in is 350,000 cases of HPV a year and 275 cervical cancer deaths per year. So pretty significant. talking about the disturbing cultural practice of female genital mutilation, it is estimated that 125 females worldwide have had some form of genital cutting. It's very closely related to ethnicity. Hopefully, the practice continues to be diminishing. Obviously, it can initially cause shock, infection, and/or hemorrhaging, and long-term problems can result in retention of urine, infertility, and obstructed labor. Violence and sexual abuse against women, there are estimates that between 10 and 50%, and in all honesty, I would probably put that number a little bit higher when we talk about women who have been abused physically by a partner just within the last year. This can lead to injuries, unwanted pregnancies, STIs, depression, disability, and death. Risk factors include low socioeconomic status, young age of the male partner, and gender inequality. And again, we have to say that sometimes culture and ethnicity can play into this as well. Excuse me. So, maternal morbidity and mortality. I tried to squish this all onto one slide. I apologize that the writing's so small. So there are about 289,000 maternal deaths. That was just in 2013. And about 60% of those deaths occur in only 10 countries as listed. Birth is the time of the greatest risk for both mother and baby. 28% of those maternal deaths are from obstructed labor and indirect causes. 80% are from direct causes. That just reeks of prevention when you think about direct causes and what can we do to prevent that number from reaching such high limits. A woman in a high-income country only has a 1 in 3,700 chance of dying in a maternal death compared to a 1 in 38 chance for women in sub-Saharan Africa. I can say that I would certainly not want to be a pregnant female in one of those lower or middle-income countries. So when we again continue to talk about the burden of health conditions for women, unsafe abortion has to rank right up there. So safe abortions, and I realize this is a controversial subject, and despite what your own personal belief in this issue is, it does need to be discussed because it does happen not only in the US, but it does happen in lower and middle income countries. Safe abortions are performed by a trained healthcare professional with proper equipment, technique, and sanitary standards. Only about 60% of these performed are safe. 13% of maternal deaths are due to unsafe abortions, and there are about 22 million of those each year. I want to say that those are going to be more focused in our lower and middle income countries. However, it is still done in the United States as well. I'm sorry, my heater just kicked on and it's too cold to turn it off. So moving on to obstetric fistula. This is a devastating condition for a mother in which a hole opens up between the vagina and either the bladder or rectum. And it can result in urine retention, obstructed birth, long-term infertility. About 50,000 to 100,000 women each year will suffer a fistula, and these women are often stigmatized or abandoned. Risk factors are those associated with an obstructed delivery. So again, it really goes back to prevention and accessibility to healthcare, accessibility to safe healthcare, to clean facilities, skilled professionals. So in wrapping up, sorry, I still have this cough. In wrapping up for the week, and I feel like I got this done in record time, yay! Some of the cost and consequences of women's health problems. Obviously, violence, STIs, and fistula do tend to isolate women socially. When a woman dies in childbirth, her family is typically left without a primary caregiver. Newborns are also at greater risk of death following a mother dying during childbirth. It's one of those things I feel like we kind of overlook it now because it is so rare in our more developed countries like the United States that we typically don't hear of a high incidence of women dying in childbirth, or typically not even newborns dying during childbirth. Sometimes when that happens, it is simply nature, and there's nothing that can be done to prevent that. So I want that to be put out there as well, that sometimes it doesn't matter every precaution, you do everything right. Sometimes nature just takes over. And finally, substantial economic costs from women's health issues. So we've kind of looked at that. Disability, life years, loss of productivity, and I think because women's health is so closely related to that of infants and children, that's why we really needed to devote an entire chapter to it. I hope I've been able to present this in somewhat of an unbiased opinion, or unbiased approach. It really does reach further than, just including women in this, because we all know one of the things, the overreaching themes of global health, is that the health of an individual is much more far reaching than just that individual. So I think this chapter demonstrates that really well. Please, if you have any questions, concerns this week, feel free to email me. It's probably a little easier to reach me via email this week at tinafreeman@cwidaho.cc. I will try to check the Ask My Instructor link, but it has been a little busy. So have a great week, everyone. Stay warm.